cover all your bases. You can tailor these recommendations to fit your own style of interviewing and sort of fit your flow of how you ask questions. But if you can get these details in your case study, then you'll have covered the most ground. So let's begin. Really quickly, before you start, get a disclaimer signed. My disclaimer, for me, I have a 35-page packet that people have to sign. Mine is a little different because people have to, sign all sorts of privacy waivers and things like that. So nothing, you don't have to maybe be that extreme in your waiver, but just something quickly saying that, you're not this is not a substitute for medical advice. Please seek your doctor's advice for any psychiatric or medical emergencies. Herbs are not FDA approved. Some of these things are just a disclaimer that you can throw in into your sheet that you get signed from your case studies. And make sure you keep it anonymous. Patient privacy is really important, and so make sure that you don't mention anyone by name or even initials. Sometimes it's really obvious who that person is, so just make it completely anonymous. Sometimes just change some of the personal details a little bit, as long as it doesn't change the meaning of the case study. But it might do that to protect their anonymity. And then put down your name, obviously, and then it would be helpful to include your batch number. So do that as well. And, a neat handwriting type, of course. And we'll look at some forms coming up, and if you want, you can tailor them the way you would like to present them. And set up an intention with the client about what issues will be addressed. Keep it sort of, keep control of the situation, because a lot of times you'll have clients who will have 30 different complaints, and they're sort of all over the map, and, they're dabbling in Chinese medicine and acupuncture and naturopathy and homeopathy and Reiki. They're kind of doing a lot of everything at once. So when you talk to them, sort of direct them and keep the exam and the history and the problems in a focused manner. Corral all those things and try to look at the big picture instead of getting bogged down in the details, because that becomes really difficult to present to your audience and also to synthesize all that information. It's like, what should I do with all this information? Patients can talk for hours and hours about their health history, so set up that intention of what you want to do and how you want to go about doing it. And find out the causative factors, the hetus, within the interview itself. All right. So here's a dosha test. Find out what the prakriti is. Use a dosha test of your choice. And remember to use the VPK format. That's how it's standardly, that's a standard way of presenting it. So, you've all seen these dosha tests. They're sort of everywhere. They're on the internet. They're in the back of Dr. Lard's textbooks. So pick something that you like and go with it, or synthesize all of those and make your own. Whatever you think will help you gather that information. So do the dosha test for the original constitution, and then later we'll be finding the vikruti through this form, okay? One way of maybe doing it is having on the left side of the paper, writing down the case study, the name, the gender. Of course, if the patient is female, then there are additional questions to be asked. And those questions are about, childbirth, menstrual history, when periods started, when periods ended, how often the periods are, how many deliveries the woman has had, the quality of her periods, how her childbirth was, how her milk production, just you guys already know that. Just a myriad other questions. Birth control options. All of that will be part of the female questionnaire. And PMS symptoms, etc. I'm just giving you an idea of what you can ask. And again, we'll be finding the Vikruti soon. So this is one way of setting up your form to keep the information organized. Agni is very important, so even before you can recommend any herbs or anything to a patient, to a client, you have to look at Agni first. This is something that Monica Ji always stresses, that, you know, a lot of times you go to different types of practitioners and they'll start giving you medications. We'll try this herb, try that herb. But in Ayurveda, Agni, looking at the Agni and looking at the quality of the malas and excretions, that is important. That comes first. Because without Agni, if Agni is not properly addressed, or if Ama is not properly addressed, then you can give all the herbs to that person, and nothing's going to happen, because you don't have the proper equipment to digest and assimilate those herbs. So start with the Agni assessment. You can do the bowel movement assessment, the Mala assessment. Determine if the state of the Agni, is it Vishamagni, is it Mandagni, is it Tikshnagni, and write that down in your assessment. Make a note of it. And then you might want to make a note of the sub-doshas that are related as well. So you can look at, ask about the patient's symptoms, such as dry mouth, or dry, is this an indication of bodhaka kapha, being low, lack of water element, or dehydration? Kledaka kapha is the mucus lining in the stomach, so ask them questions. Do you have ulcers? Do you have a history of, heartburn? Does anyone in your family have a history of ulcers? And then pachak pitta, you're going to ask about the quality of their digestion. Do they have a lot of acid reflux? Is it like the sour, acidic burps that are refluxed into their mouth food content? Do they have this general burning in their chest? Or, is their digestion pretty okay? What's their hunger like? How often do they get hungry? Do they experience true hunger or emotional hunger? How often they eat, etc. And Samanavata relates to the movement and peristalsis of food. So is the food just sitting there in their colon and in their gut? Do they feel bloated? Do they feel heavy? Or are they able to digest the food and feel light afterwards? Are they able to eliminate properly through their apanavata? How are they eliminating? What is the quality of their stool? Is it sticky? Does it float? One question just to be aware is if your patient has any history of Crohn's disease or Crohn's or ulcerative colitis, make sure you ask them those questions, because that's very important, because that can be kind of dangerous territory. You don't want to tread in. I'm very careful with those patients, and often I will refer them to people who have that expertise, because it's beyond my scope personally. So I just feel if you have someone with colon cancer, things like that, ask them. But other than that, you're going to ask them, are they gassy? Do they expel a lot of wind? Do they have irritable bowel syndrome? Are they having a bowel movement daily? Is it after meals? Are they little pellets? Or are they pretty constipated up until their period, and then they have a good bowel movement for a day or two? So a lot of questions that you want to ask. And Monica Ji makes a good point. She also says to address food allergies. So does this person have celiac, sprue, lactose intolerance? It's sort of the buzzword, sort of fashionable for everyone to have a gluten allergy these days. Everyone has a gluten allergy. It's simply, I would say, not true. you can have people who are truly cannot handle gluten are those who have celiac sprue. The rest of us, it's probably not the best thing to do. A lot of the wheat these days is genetically modified, and it's not the same wheat that our ancestors had. And but it's and it may cause bloating and things like that, weight gain and sluggishness. But it's not a true allergy. So ask them if it's a true allergy, if they have celiac disease, or if they develop hives or rashes or anaphylaxis or some reaction towards the wheat protein or wheat gluten. Agni assessment, this is another, and I've sort of covered this already, but ask them if their digestion is fair, good, poor. Ask them about their appetite. How is their energy during the day? Is it strong? Is it medium? Is it low? Is it off and on? Is it in spurts? Do you feel heavy after eating? Do you feel sleepy? And do you have a problem with gas, flatulence, belching, bloating, heartburn, acid reflux, etc.? And any foods that cause discomfort. So be aware. Now, just let me interject my own thought process with just a few red flags here. If the patient is losing weight rapidly, that is a red flag for you. If the patient has bowel movements that are producing blood, bright red blood, that is something to refer. Have the patient see their regular doctor. It could be something as simple as a hemorrhoid, but you just never are sure. You don't want to be make the mistake of having a patient with something like a colon or rectal cancer that is missed just because they coincidentally have a bleeding hemorrhoid. So just any blood from the rectum, make sure you're really careful about that. Any black, tarry, sticky, foul-smelling stools. I'm not talking about the type of stools that is laden with ama, but I'm talking about a stool called melena, which is a black stool. That is also dangerous because that indicates some sort of internal bleeding in the higher up in the GI tract. So those are some red flags I thought I would just mention here since we're talking about digestion. When you hear those clues from a patient, make sure they see a doctor. Do your bowel movements tend to be regular or irregular? How often do you go? Do you need a cup of coffee just to go? A lot of times Vata people will not go in the mornings, but if you have them wake up during Vata time and drink a cup of warm water or a cup of warm water with some sesame oil in the winter, they'll have a bowel movement because it's naturally the Vata time of day. But if they wake up too late, they'll have slept through that time and they will have had a bowel movement sensation, but it's so weak that they'll have slept through it. So then they wake up in kapha time and their bowels are locked up. So just a recommendation. How often do you have bowel movements? When do you have them? First thing in the morning, later in the afternoon? Monica G, I think a couple lectures ago, made a few points. For Pitta, going to having a bowel movement 2 to 3 times a day is their normal. Kapha going once a day is their normal. Vata going once a day is their normal. But Vata not going for 2-3 days is abnormal. So make sure you keep their Prakriti in mind and adjust your expectations for what is normal for that person. Also, yes, if you read the chat notes on the side, Monica G always has good pearls, chronic constipation, and sticky stools in someone who is not someone who's taking iron pills. Also, Pepto-Bismol can also cause black stool, so ask them. A lot of times, and I'm kind of going on tangents here, I had a medical student shadow me the other day and was freaking out because a patient had red stools, and I asked the patient if they had beets, and the patient did. Anyway, we still checked their stool to make sure there was no microscopic blood, and there wasn't. But sometimes beets will also give you these stools that look bloody. So just ask them if they're having beets. So color of stool is really important as well. And ask them about their consistency of stool. Yes, also urine can be pinkish or dark, and carrots will also change the color. So, Mala Pariksha, I think I've talked about poop enough. Mala Pariksha, let's talk about, let's see, oh yes, just to reiterate, someone was asking how many times is it normal for Vata. Okay, so this slide will answer the question. 1 bowel movement a day, sluggish and heavy after eating, dull appetite is Mandagni. That's Kapha type. So that's your answer for Kapha. For Vata, here we go. 1 or less BM a day, prone to constipation, dry hard stools, gassy, flatulence, variable appetite, because that Agni is very flickering in nature. Vishamagni, it's irregular. That's Vata. 2 to 4 bowel movements a day, loose stools, not watery diarrhea, but soft, loose stools. Sometimes the stools can run on the acidic, burning side. That's when you have too much pitta. But usually after the strong urge to defecate after meals, acid reflux or acidity, strong appetite, Tikshnagni, that is indicative of pitta. And ama, look at the client's tongue. If it has any white coating, even after they've brushed their tongue, it may be ama. And I think we've had a workshop where we've looked at the tongue, right? And the corresponding areas, the organs that match. So get an idea of what's happening with their ama, where it is. And also, high ama is one of the symptoms is feeling fatigue, sluggish, even after a good night's sleep, feeling heavy. That's also a sign of ama. So here are the questions for the women. So pitta women will have heavy bleeding. They will have regular cycles, painful cramps. They may get moody and cranky, temperamental, and hot in their premenstrual time. They also may have a heavy bowel movement as well. Vata generally sometimes has irregular periods. They may have low, scanty flow. They may have cramping. It's not as maybe as intense as pitta, but they have some cramping. Flow lasts is scant 1 to 3 days. They tend to be anemic. They may get polycystic ovarian syndrome. They tend to get PMS, bloating, gas. Generally, Vata people, like I said, are constipated. So with their periods, they get some bowel relief. Naturally, the Apana Vayu is pushing out the menstrual fluid and aids in getting out the stool as well. And Kapha women have generally regular periods, thick flow, tend to bloat up before their periods. They tend to have a weight gain in the breasts and in the abdomens, and the breasts become tender. And of course, everyone can have some of each. These are general sort of clues. It's not that a Kapha woman can't get temperamental or a Vata woman can't have heavy bleeding once in a while, but these are just some of the themes that be aware of. Let's see. So after the Agni assessment, we look at the Vata, Samana, Apana, Prana, Udana, and Vyana, get an assessment of that. And here is the form for that, I believe, the subdoshas for the Vata, Kapha, and Pitta form. So I think you can download a copy of this from the website, but or you can make your own up as well. Let's see. It's a little small, but you can come back to this and expand it later and take a look at it and ask them detailed questions and get an idea of the status of the sub-doshas of Vata. Pitta as well, do the same thing. Go back to that form and look at all the sub-doshas for Pitta. And we discussed some of them in that previous slide, but you're going to want to address their Pachak Pitta, Alochak, Vrajak, Ranjak, and Sadhak Pitta. And there are many, many ways of assessing these forms of Pitta, and your lecture so far will outline how to do this. Let's see. We have it. Here we go. So here is an example of what you can do. You can make a copy of that case study form. And here you have on the left side, you have the column which, outlines the sex and the age and what age of life they're in, and their prakriti, their vikruti, and all their malas and agnis. And then whoever, I don't know whose form this is, but they did a good job of, there's plenty of white space around this table. Make notes. What are their exacerbating factors? And then look at their subdoshas, pittas. This person has rosacea, T-zone oil, night sweats. Are these indicative of a Brajak Pitta problem? Oh, Dr. Shelley did this one. Yes, this is really nice. So you have, let's see, Alochak Pitta, eyes are red, watery, stinging. Are the eyes sensitive to light? And you also look at their Pachak Pitta as well. So anyway, get an idea from this how she's done it, and it can be pretty. Everything's outlined for you. It can be a pretty helpful guide that's already in place. So I say, why reinvent the wheel? Look at this and let this be your guide. This seems to work really well. Okay. All right. And now we can go through the digestion-related sub-doshas, Bodhak Kapha, Kledak Kapha, Pachak Pitta, Saman Vata, and Apan Vata. So you've addressed their Agni, you've addressed their malas and their digestion, and now go through these sub-doshas that are related to digestion. Like Bodhak Kapha is responsible, it's in the mouth, it's in the saliva, it's responsible for creating that soft bolus of food that you can swallow easily. It has enzymes in it to digest the fats and starches in the mouth. Isn't the mouth amazing? Think about it. That mouth is where the digestion begins. You could eat a greasy, oily basket of fries, but is your mouth ever greasy? It's just never greasy. Why? Because you have lipase, lingual lipase in the mouth. You have amylase, which digests starches. So make sure you eat and chew properly and bathe that food and saturate it with saliva, because that is already digestion. That's Bodhak Kapha right there for you. And there's also some mucus in there to soften it. Kledak Kapha is that protective lining in the stomach. Ask them about a history of ulcers or burning in the stomach. Ask them about a family history of ulcers. Pachak Pitta is the Pitta responsible for digesting the food, the hydrochloric enzyme, the pepsin, all the enzymes that are in the stomach that break the food down from large gross particles into components such as amino acids, etc. So ask them about the quality of their digestion and if they feel, how their digestion is. And then Samana Vata is responsible for the assimilation and the distribution and of those nutrients, the assimilation, and then Apana Vata. So the elimination. Again, we'll go through this form later again, the form itself. Monica G is telling me. Okay? So I hope that sets the stage for how your thought process maybe should be when you're doing this case form. I know it's overwhelming. There's so many things to ask the patient but over time you get better and better at it. Trust me, it does get better. Just like anything else, right? Any of our skills, just practice. So this is a good example of a case study form, disclaimer. I, so-and-so, am a student. I'm not medically trained. The advice given in this session is provided in an information resource, as an information resource, not to be relied upon for diagnosis or treatment. This session is not a substitute for medical care, professional care, urgent care treatment. Please consult your doctor before making any decisions, etc. Then put your name down. I disclaim responsibility and shall have no liability, etc. And this is something that you have them sign and date. Yes, so this particular form just makes something different. Like I said, mine is 35 pages long, and not all of it is signing. A lot of it's reading, and because I use electronic medical records, so they have to know about privacy breaches, what to do, things like that. They have to know. In my disclaimer, they're given the name and number of the people at the medical board. If they have a complaint, they have the right to know whom to complain to. So that is different. So everyone has a different background. You may not need 35 pages of a disclaimer. But being a physician, that's unfortunately the legal system has put that burden on me. So, yes, so like Monica G, for example, has a massage license, a yoga license. She's an herbalist. So Dr. Kirti is an Ayurvedic physician, and though her scope of practice is so wide, in India she has her own clinic. She's an independent practitioner. She practices Western medicine as well. She's thoroughly trained. She has also been trained, like, for example, Dr. Sahana is an Ayurvedic surgeon. I mean, these are amazing people. And in India, the informed consent process is completely different. But here, just because of the legality of the system, they can't do things like check pulse, or they can't administer nasya, or they can't give enemas, or they can't do vamana therapy, or there's a lot of restrictions. So make your own disclaimer based on your own training. This is a guideline. Some of these elements are common to all the disclaimers, namely, make sure you consult with your doctor. This is not a substitution for medical advice. Even my disclaimer is, my Ayurvedic diagnosis is not a diagnosis that they can hang their hat on, so to speak, because it's not a quote-unquote medical diagnosis. So even my form says that as well. All right. I am talking too much. I think it's time to move on. All right? Thank you. I hope that made sense. I hope that was helpful. And now Dr. Monica is going to go through the form itself. And then it would be helpful to include your batch number. So do that as well. And, a neat handwriting type, of course. And we'll look at some forms coming up, and if you want, you can tailor them the way you would like to present them. And set up an intention with the client about what issues will be addressed. Keep control of the situation, because a lot of times you'll have clients who will have 30 different complaints, and you get signed from your case studies. And make sure you keep it anonymous. Patient privacy is really important, and so make sure that you don't mention anyone by name or even initials. Sometimes it's really obvious who that person is, so just make it completely anonymous. Sometimes just change some of the personal details a little bit, as long as it doesn't change the meaning of the case study. But it might do that to protect their anonymity. And then put down your name, obviously, and for all your bases. you can tailor these recommendations to fit your own style of interviewing and sort of fit your flow of how you ask questions. But if you can get these details in your case study, then you'll have covered the most ground. So let's begin. Really quickly, before you start, get a disclaimer signed. My disclaimer, for me, I have a 35-page packet that people have to sign. Mine is a little different because people have to, sign all sorts of privacy waivers and things like that. So nothing, you don't have to maybe be that extreme in your waiver, but just something quickly saying that, you're not this is not a substitute for medical advice. Please seek your doctor's advice for any psychiatric or medical emergencies. Herbs are not FDA approved. Some of these things are just a disclaimer that you can throw in your into your sheet. They're sort of all over the map, and they're dabbling in Chinese medicine and acupuncture and naturopathy and homeopathy and Reiki. They're kind of doing a lot of everything at once. So when you talk to them, sort of direct them and keep the exam and the history and the problems in a focused manner. Corral all those things and try to look at the big picture instead of getting bogged down in the details, because that becomes really difficult to present to your audience and also to synthesize all that information. It's like, what should I do with all this